I'm Abosede. I've been in Ogbomoso for the past 13 years. I came in as a nursing officer, but now I'm a chief nursing officer at LAUTECH Teaching Hospital, Ogbomoso. Being a nurse is a passion. That is, nursing is a noble profession, and I have passion for helping people, saving lives, tending to people that are in need, because it requires me being there for them. For instance, when a baby is coming to life, and at that point when a life is going back to heaven, it's really a path that I chose because I love helping people a lot. So I enjoy doing it with all my heart. Actually, it was not a decision I made right from childhood. Right from childhood, I wanted to be a pharmacist, but thanks to my dad, I owe him that a lot, because he actually dictated some features in me when I was little. So anytime I'm telling him that I wanted to be a pharmacist, he would just tell me, you are going to be a nurse. To the point that he gave me a name. He always called me baby nurse. I was writing my work. He was the one that took the form for me. I have to go for the exam. I was so reluctant to write the exam per se, because my aim was to go to the university direct, obtain my degree in pharmacy. But no, he insisted that I'm not going to write that jump. He took the form for nursing school then. That time most of my mates were like, no, everybody's going to the university, you want to go to school of nursing, because that time we always categorize school of nursing like a senior secondary school, so nobody wants to go. Talk less of a mission school, because I attended mission school and we have a lot of rules and regulations that you must follow. So we always categorize it as, no, it's higher secondary school, it's not an institution per se. But I've never had any regrets in being in nursing profession from that time. At least I've been in this profession for the past 20 years and I enjoy every bit of it. Right from time, I've been to different departments as a nurse, from medical department to the emergency wards to the obstetric and gynecological ward, but presently I'm the radiological department. And in radiology we have 3 sections, which involves the MRI unit, that is the magnetic resonance imaging unit, where we had series of tests being done. Then we have the X-ray unit, we have ultrasound unit, and the CT, which is the computed tomography unit. It has been a lot because presently we are short-staffed. So in the whole department we are just 2 nurses that run scatter to attend to patients, and the whole unit is not situated in one place. So you have to move from one section to the other in order to attend to patients. Although it has been stressful, but the beautiful part of it is you see people get their tests done and they are satisfied, and that's the most appropriate thing to do. MRI machine, let me say the magnetic resonance imaging machine, is a type of machine that usually dictates the real cause of what is actually wrong with the patient. Before a patient will be given a request form to go for an MRI, definitely they might have done all the preliminary investigations, the X-ray, ultrasound. So the highest one is the MRI, because they want to know the exact cause of the patient's ailments. So that's why we have series of patients coming from different parts of the states and the country, because in Nigeria as a whole we don't really have much MRI in place, especially in this southwest. We really have there is MRI in LAUTECH Teaching Hospital, we have in Ibadan Ring Road, which is ABC, then we have in Ado-Ekiti, which is Habwatch. So most of our patients come from different parts of the state. At times we have even patients coming from Ibadan, coming from Ile-Ife, Osogbo, Ilorin, Jeba. We've had patients that comes from Bida as well, because it will be the major diagnostic for the patients. Wow, I've come in contact with lots of patients, I won't lie to you, but the most important thing is this MRI will help to facilitate the treatment of the patient. Like there was a patient that came that had bleeding in the brain, and then the patient was not sent down for MRI. They won't know that there is a vein that has thrombosed in the vein and the patient is already bleeding. So after the MRI, immediately the patient has to be referred to a neurologist and they had surgery done. We call it borehole. So they used it to drain the blood, and the patient was okay. In fact, the next time I saw the patient, I was very happy because the surgery was successful and the patient is still alive. The patient did not come for MRI at that time, or was not sent for MRI at that time, or maybe financial issues arose then and they were unable to do it, because MRI is costly. I won't lie to you. It's not a test that you just gather a few money and do. But I thank God for the life of the patient. The only thing I put in place every day when I'm coming to work is I'm going there to save a life. Despite all my own personal challenge, there are times I will not be feeling fine, but I still have to help others. There are times you'll be having serious backache and you get to work, you see tons of patients that you need to attend to. So I still have to man up so that I'll be able to save those lives. Nursing is beyond clinicals, because we are dealing with human beings and it's a work of humanity. The first thing as nurses we try to do is to establish a patient-nurse interpersonal relationship. That is, you first welcome them to the environment. They are coming to a new environment. They are not familiar with you. They are not familiar with the machine. Some people even tell you that machine is like a coffin, that we are putting inside coffin because it's a little bit scary, because the inner part of the machine is white. It's just like a coffee actually. So, and when you are there, we always tell the patient that the patient will be the only one that will be in the machine. Nobody will be there with the patient, although the radiographers will be looking at the patient from where the machine is being operated. So the patient is not left alone, and there are speakers on the machine in case of emergency. The patient can press a button and talk, so that we know what is actually wrong with the patient. And that machine requires the patient to be calm. The patient that is in a machine must remain calm and still, because the moment the patient is moving, it will alter the images will become blurred, it will not be clear, and we'll be able to report it. Then apart from that, the machine makes a lot of sound when it is scanning. So those are the things we tell the patient before the patient will even enter the MRI machine. Then we have a checklist that we fill for the patient. The most important question we ask the patient is whether the patient has any form of implants in their body, especially metallic implants. If it is metal, the patient will not be able to stay in the machine because the machine is magnetic. Any form of metal like this, the machine will try to pull it out. So we usually ask that question. Then we also have other questions that we have, like their past medical and surgical history. We want to know whether they have any form of kidney disease, because we are giving a contrast agent to enhance the image. So we want to know, because any drug that is entering the kidney will be the one to detoxify. So we want to know whether the patients have any form of disease that they are managing before. Actually, people in Ogbomoso, let me say, some people are ignorant of what is actually happening in LAUTECH Teaching Hospital, because in LAUTECH Teaching Hospital we have different specialists that handle different kind of illness. For instance, some people prefer to go to a private hospital, and in that private hospital it might just be a doctor that is attending to all the patients that comes, which is supposed not to be. Because in LAUTECH Teaching Hospital we have different sections. We have the ophthalmologist that tends to those that have eye problems. We have the internal medicine. Internal medicine are the ones that deals with people that have this all these heart disease. Endocrinology, we have endocrinologists too. So even in internal medicine, they have different sections, they have different specialties. So, but people tend to say, okay, when you go to LAUTECH Teaching Hospital, they will make you to suffer. At least I've heard that one, that they will be telling you to go and do this, go and do this test, go and do this. The reason why they are telling them to go and do all these investigations is to know what is actually wrong with the patients. You can't just come to the hospital, you complain, and the next thing for us is to give you drug, give you injection, go back home. At times we might just treat the surface, and what is actually wrong, what is actually causing the illness will still be underneath, that is not being treated. That's the reason why we ask you to do a lot of investigation, so that we'll be able to arrive at a conclusion to know what is exactly wrong with the patient. So if anybody is watching all over the world, in Nigeria, in Oyo State, in Ogbomoso, I really want you to know that LAUTECH Teaching Hospital is a great hospital that loves to help patients, and you can refer patients to us at any time. You'll be attended to. We run a 24-hour service, and all our nurses, our doctors, everybody that is in LAUTECH Teaching Hospital is friendly, Thanks so much, and God bless you.
So,
Ogbomoso is a home to me because I've been here for more than a decade. Really, I'm not the outgoing type. The environment is lovely. I enjoy the environment a lot. And the people in Ogbomoso too, they are friendly. And the market too is cost friendly. At least you can manage yourself and make a living while in Ogbomoso.